So my name is Gwen Nichols. I am the Chief Medical Officer at the Leukemia Lymphoma Society. And I'm going to be talking about a really important abstract for the Leukemia Lymphoma Society that was just presented at ASH. And this is abstract 1492, which is about APAL2020SC, which is our screening trial for children with relapsed acute leukemia. Now, you might say, gee, that doesn't seem like something novel, but the reason that it's novel is that we have a lot of genomic data around the country and in fact around the world on children with relapsed leukemia, but it's all in tiny pieces at different institutions. We have never collectively annotated that, nor had sequencing on all the children with relapse. And so the Leukemia Lymphoma Society, as part of our PedAL project, Pediatric Acute Leukemia Master Trial, we started with a screening trial which allows investigators, pediatric investigators around the US to send their the child's screening blood work for centralized flow and for sequencing through Foundation Medicine. And LLS is paying the cost of this sequencing, so the families do not need to bear that cost. In this way, we'll have information that will allow us to better understand the genetically altered subsets of acute leukemia at relapse, something we haven't had before. The last Children's Oncology Group trial had about 40 patients over many years. In the first 16 months that we've had the screening trial open, we have 220 children sequenced who've had relapsed acute leukemia. This information will be priceless for us to understand what targets we need to go after in the future and to give our pharma partners an understanding of how these children do, because we are also collecting outcome data. So when you bring a new therapeutic to market, you now can look into this database, and it is going to be publicly available so that investigators can see this. You will know how many children with your target there might be in a year in the United States, and also know what their outcome is with standard of care. This is incredibly important for planning for the future, to have that information, and we really haven't had it consistently done in the past. So we're very excited because this is the entry point into our PedAL Master Trial, which is a global effort to find new targeted agents for children with acute leukemia.